Gonna have a good day.
Making sure your heart keeps ticking. Taking a look at a mobile heart screening bus. What can I say?
And welcome back to Good Day Tampa Bay, everybody. We're on what they call the Heartbeat Bus. February is American Heart Month, and it's a time for people to focus on heart issues. As I said, we're inside the bus. Let's show you the outside of the bus because it is so cool, and it's in our palm court, and they brought it to us this morning, and it's just a fun thing to be able to show off. And we have Dr. Ajoy Kumar with us right now. Family practice?
Family medicine, correct, at Bayfront Health.
With Bayfront Health, who sponsors this, we should point that out. The importance of this bus is what? Basically, it can come to you.
That's right. I think one of the biggest things that we talk about in healthcare is the individual taking responsibility for their healthcare. So this bus actually kind of lends to that, such that the individual comes here and gets the healthcare and gets the screening services that they want to get. And once those screening services are done, if any abnormalities happen or found, what the folks here do is they transmit that information to primary care physicians such as myself, so we can sit and have a meaningful conversation with the patient.
John, I'm going to let you make the walk back into one of the exam rooms. That's Katrina doing the work. That's Stan being examined right now. Doc, tell me things that can be done on this bus.
So some of the things that can be done as you're looking at your screen right now is that you're getting evaluated for peripheral vascular changes. That's a sign of coronary artery disease as well as cardiovascular risk as well. You get your EKGs done here. You can get your carotid arteries measured to see if there's any kind of what we call occlusion or stenosing in that area. And depending on what you find in those things, that gets referred to us to see if there's any further testing that needs to be done. In addition, there's blood work you can also get done too. So your cholesterol panel gets done here. You can get other things in terms of your blood work so that we can have that discussion to see how do we lessen your cardiovascular risk.
I asked you earlier before we started, I said, is this new? And you said, no, it's been around a while. But the fact that healthcare has changed so much, more and more people are taking advantage of it, and in a lot of ways being forced to take advantage of it.
Well, I think it's an exciting time to be in healthcare. And the reason why is because people are starting to see the benefits of being responsible for their own healthcare. So, you know, outfits like this really give an individual the opportunity to go out and get those screenings that they think are necessary so they can have a sit down and conversation with their primary care physician. And that way that leads to early diagnosis, early treatment, early management, so you don't end up in the hospital or in the ICU.
And one thing I think we need to point out here is in a lot of times some of these procedures you may be getting on this bus may not be covered by your insurance company, but the way you all have managed to do these things, it's a lot cheaper than having to go to a doctor's office.
Well, absolutely, because a lot of the hospitals these days are buying out physician practices because they want to consolidate healthcare. So what you're starting to find is the fees for going to and getting a lot of these screenings done is pretty exorbitant. And as you know, number one cause of when you end up becoming bankrupt these days is from medicine. Medical care.
Medical bills.
Medical bills, absolutely. So what ends up happening is that when you go to screenings like this, they package the screenings together. And oftentimes it's far cheaper to get the screenings done in settings like this versus going to an outpatient radiology facility or outpatient clinic, which takes tons of blood samples but sends it to a hospital or whatnot to get the blood work done. And people find that to be a lot more economical in terms of healthcare.
Yeah. Hey, thank you. Thanks for coming over. Thanks, everybody, for bringing the bus over this morning. Appreciate it very much. Stan, Katrina, thank you. You're welcome, they said. I want to tell you, if you want to know how to find the bus, go to Bayfront Health Fair, BayfrontHealthFair.com. We'll tell you, go there. We'll tell you how to find out if the bus is going to be in your neighborhood, is what I was trying to say. Anne-Marie, what are you telling me? Oh, we put it up on our website, myfoxtampabay.com. Doctor, thank you.
Thank you very much, and please get your screenings this month.
It's a perfect month to do it. Back to you guys.